Dr. Sileo, how are you?
Dr. Shaughnessy, great to see you.
Oh, it's so good to see you, and thank you so much for taking time to speak with me today and share a little bit with our viewers at home about the new St. Catherine and St. Charles Center for Health and Wellness. Tell us a little bit about the types of services offered here at 500 Comac Road.
The center is a fantastic open-air facility that has physical therapy, orthopedics, advanced imaging, including MRI, CAT scan, digital X-ray, as well as primary care, all under one roof.
So that's great for patients, right? Because think about it, someone could come in to see you for an orthopedic problem, get fully worked up, evaluated in a beautiful state-of-the-art facility. You can bring them right next door, get them imaged for what you need. And then if you find out they don't have a primary care doctor, which a lot of patients may not, you can plug them in with someone wonderful right here. And really conveniently located, right? Right on for Comac Road, right off of Northern State Parkway. Easy access for your patients?
The location is fantastic. For patients coming from Nassau County, it's right off the Northern State and Comac Road. For patients coming from Suffolk County, it's again right off the Northern State and off of 347, so it's central to both counties.
And so what's been some of the feedback from the patients that you've cared for here?
The patients love it. The patients love not just the feel of the facility itself, but they also love the fact that it's one-stop shopping, as we said. So I can recommend physical therapy and walk them over and introduce them to their physical therapist. If we need to get an imaging study such as MRI or CAT scan, a lot of times it can be done the very same day. So the feedback has been nothing short of fantastic.
Well, that's a perfect segue because I'm sure our viewers at home would love to see more of the facility. Would you be willing to take us around?
I would love to.
All right, let's go look.
All right, come with me. So this is the main corridor of the facility. This is where patients check in. Down the hall we have exam rooms, our concussion rooms. Physical therapy is down the hallway that way. And then right along this way we have our digital X-ray and our advanced imaging right beyond that.
So this is all digital and state-of-the-art?
All digital, all state-of-the-art. We have access to the imaging not just here in this facility, but any of the offices at the hospital as well.
That's great.
It's all integrated.
Why don't you show me? Come. And now we're in the diagnostic imaging section of our St. Catherine and St. Charles Health and Wellness Center at 500 Comac Road. Tell our viewers a little bit about what's here.
This is the Diagnostic Imaging Center. In this facility we have advanced imaging including MRI and CAT scan. This particular MRI is a 3T imaging device.
And what does that mean? For our viewers at home, what does that mean?
3T basically stands for 3 Tesla. It's essentially a way of how much resolution the MRI actually provides.
So state-of-the-art.
State-of-the-art, the newest of the new. We're able to do arthrogram studies here of the shoulder and hip. We're also able to do ultrasound exams, ultrasound-guided injections, again, all under one roof.
Oh, that's amazing. And again, all under one roof. So literally the patient could leave your office, come right down here and get the test done.
Directly adjacent. And then we also have CAT scan capability here as well, which is not just used for orthopedics, but for non-orthopedic indications as well. A lot of times our patients who have joint replacements frequently require CAT scans preoperatively for templating, and we're able to do that again, all under one roof.
Share a little bit about what you do.
I'm board certified in orthopedic surgery and sports medicine, so my area of expertise is really focused on the shoulder, hip, and knee. My focus is on arthroscopic surgery of those joints, so ligament reconstruction, cartilage procedures, instability type of problems, and the like.
So you see a lot of athletes, you could see people through all age spectrums as well.
Correct, yeah. My practice focuses more on the high school and collegiate athlete, the weekend warrior. That's all of us to some extent. But it really runs the spectrum. We have, all under this roof, we have specialties ranging from pediatrics, we have hand and foot and ankle specialists, we have joint replacement specialists, spine specialists, we even have concussion testing and concussion specialists all under one roof.
Yeah, it's amazing. At CHS we've been so fortunate that we've aligned and built out our service lines with the finest physicians, surgeons, diagnostic equipment, but we're really taking a special effort now to make these services more easily accessible to people in state-of-the-art facilities. I actually feel relaxed here, and I'm not so relaxed around going in for MRIs. I've had them, but I would get it here no problem. I feel good about being here. Do patients tell you that? It's a relaxing environment?
All the time. Yeah. It's got a very warm feel to this facility itself as well. So nobody loves going for an MRI or a CAT scan or any kind of test, but I think our goal is to make it as easy and as comfortable as possible.
So great marriage of best people, best doctors, best equipment, in a state-of-the-art facility. What do you think?
I think you're hitting the nail on the head.
It's great. Dr. Sileo, thank you so much.
My pleasure.
It's great.
Great to see you.
Thank you.